Now, you mentioned hormones. I would imagine that is a huge, huge topic that we can address here. Do hormone imbalances, of course, thyroid is hormone, but when I think of the hormone, I think of estrogen, progesterone, testosterone. Where is their role with imbalances in the topic of fatigue?
Right, yeah, when people say hormones, I mean, yeah, thyroid, so many hormones, and thyroid and cortisol and DHEA, all those are hormones, but when people say hormone replacement, you think estrogen, progesterone, testosterone. And those also play a big part in fatigue as well. And you look at typically in perimenopause, which is the time before menopause in women, and during menopause, what's the biggest symptom for women is fatigue. Also, PMS women very frequently will suffer from fatigue. And so hormones do play a big part, and so you want to optimize those hormones, and you can often really help out those symptoms of that dragging. Also, irritable, depression, all those things can really respond to optimizing hormones. So typically, as a woman in the perimenopause period, every woman's different, but generally you're going to have progesterone levels drop faster than estrogen. So even though the doctor will check their estrogen level, it's fine, women will have more signs of low progesterone, which is irritable, PMS, insomnia, just kind of anxiety, don't handle stress as well. Then as you get more in the menopause, you start getting more of the estrogen symptoms with the hot flashes, the insomnia, the cognitive dysfunction, where I just can't remember anything. Where start to age much faster, the skin starts wrinkling, it starts getting drier. So all those things play a part in different times of a woman's life.
And doctor, when we see patients, and patients come in all the time complaining of just what you talked about, irritability, mood swings, anxiety, what's our clue that we need to be running more lab tests to check on these hormone levels?
Right. What's the first thing a doctor will do when they hear those symptoms? They'll say, oh, you must be depressed, here's an antidepressant.
Exactly.
And then sets off what happens when they get an antidepressant. They basically start gaining weight. Now I need something for the weight, and also it causes insomnia, and I need something to sleep, and it's this vicious cycle. So if you actually understand the hormones, say, oh, wow, these patients are very likely low progesterone, and you fix that, oh my gosh, all of a sudden they're better. Also interesting, several studies have shown clearly that women who have PMS, 80% are low thyroid. But again, the TSH and the T4 look normal. But more sophisticated testing, including what's called the TRH stimulation test, which generally it's too difficult to do in clinical setting, but showing that these patients are low thyroid. So you add a little bit of thyroid, a little progesterone, and oh my gosh, she's like, I'm just like back to my old self. Where the alternative is, where they normally get is, here, take this antidepressant, and then people don't feel right, they feel flat, they're just, and just kind of numb. And they have all the side effects of the antidepressants as well, instead of fixing the underlying problem.
And doctor, and I can tell you, a part of the dilemma being in the healthcare field is that we have standards of care that are outlined for us. A patient comes in with depression, we are to evaluate and strongly recommend an antidepressant. If they have mood swings and irritability, these are the standards of care.
Right.
And so can we talk a little bit about that, where we need to shift in our healthcare system? I know our listeners are primed to hear this.
And you know what's very interesting, and you know what, the majority of doctors, and this has been clearly studied and published in Annals of Internal Medicine, Journal of American Medical Association, is that the average doctor is practicing 10 to 20 years behind what is available in the medical literature. And say, well, why? How could that be? Now, so what they found is doctors don't read medical journals. They don't. They don't have time. There's thousands of studies coming out every day. How would they keep up? So what they do, they rely on drug company reps to bring in the studies, of course, those studies about their drugs, and basically go to their conference once a year, which is usually Hawaii. Now, and so what happens is these studies come out. If it's not a new drug, if it's a new drug, it gets accepted very quickly. But if it's not, it takes 10 to 20 years to get accepted into mainstream medicine. And what they found is, again, the reason is because doctors read medical journals, but even a bigger reason is that when a doctor, even if they're given the information, here's the study showing that what you're doing isn't right, here's a better way to do it, If it's not what the doctor was taught in medical school, he didn't want to hear it. So really, it shows that the doctors, they want everything very simple, and that's the way also insurance companies, and unfortunately doctors now, they will basically, if the insurance company doesn't cover it, then they don't even consider it. Basically, insurance company dictates what is the standard of care. Exactly. So if they have these symptoms, this is what you get. That's what's medically necessary. But instead of treating the underlying condition, which may take a couple more tests to figure out, but the insurance company says you should do one of these two things and doesn't really care about if you can find what's the underlying condition or not.
And I'm hearing this more and more. I could tell you more and more of my colleagues are saying, you know what, we're sick and tired of it. We are tired of the insurance companies telling us what we can and cannot do. But where does that leave us? Now we've got all these health reform debates. We've got unbelievable dialogue going on as to the model of the healthcare system that we may or may not adopt here. But where does the average doctor go to make their voice heard? And for our listeners, where does the average patient go? Where does the consumer go to get this message to the legislators that we need a changed healthcare system?
You're right. I think it's a big problem, and I blame doctors as a reason for all this, because they have, even though well-meaning, they said, well, let's do what's right for the patient, which is, again, but they've allowed the patient to be harmed because they've given up all the control to insurance companies and say, well, let's do what the insurance company wants. Okay, let's try to keep it cheap. And when you think about it, let's say we had milk insurance. Say, well, okay, how much is that carton of milk? Well, we don't know. Let's bill the insurance $200 and let's see how much we get back. Oh, we got $50 back, but now we're going to bill the patient $25 to make up for all that time it cost us to bill the insurance company. And you can see where if it was just pay cash, how much is it? Well, the carton of milk is $10. Okay, look how much money you save. And this is what's happening. There is so much money going towards this bureaucracy of insurance companies and all to the paperwork, and doctors are going crazy and patients are going crazy. Nothing's ever covered. And who's the people making money? The insurance companies.
Exactly.
And, everyone else was, basically the profits are down. They're going out of business. Insurance companies having banner years because they don't cover anything. Again, they fall back on it's not medically necessary. Or let's say you basically want a medication, and they'll say, well, we'll cover it if it's medically necessary, but we want you to write down every medication the patient's been on for the last 5 years, why they went off of it, what was the dose. I mean, so it takes you 20 minutes to fill out the history for the patient to try to get it covered. And so the doctors say, well, forget it. I'm not going to use it, even though it was a good patient.
Exactly.
And so the whole system is a mess.